having a lovely Monday. So I can advise that we have 0 local community cases, which is fantastic news. We do have 5 overseas cases detected in hotel quarantine, which of course shows that our hotel quarantine system is working, picking up these cases. We now have 20 active cases. In the past 24 hours, 9,648 tests. Yesterday, Queensland Health did 10,192 vaccines, which is fantastic. And the walk-ins down at Logan, we saw over 800 people do those walk-ins, which is fantastic. And there are walk-ins again today at Logan, and we'll be looking at more walk-ins across the state as more vaccination hubs come online. So we've got 53% of eligible Queenslanders have had their first dose, and 34.51% are fully vaccinated. As I said yesterday, and I'll say it again, this is our window of opportunity, Queensland, to get vaccinated. Make sure you register with Queensland Health, or go and see one of the 300 GPs across Queensland that can vaccinate you, or drop into a pharmacy. Queensland is responsible for doing 30% of the vaccines. The Commonwealth Government is responsible for 70%. If we get more supply, we're happy to do more. So, we're working cooperatively together, and it's fantastic that the federal government has been able to secure those extra supplies, which I mentioned yesterday. Now, Dr Young will talk to you about the situation of that Beenleigh cluster, but that risk is decreasing, which is good news. I know a lot of people were coming up to me on the weekend concerned about whether or not we were going into a lockdown, but we've got less risk now. It's easing, and Dr Young will go through that. So another reminder again, use that check-in app. Remember, we had the issue at the nail salon where people were not using that check-in app, and I'll remind business owners again, please make sure people are checking in before they come in and use your services, and that is keeping Queenslanders safe. Dr Young will go through about the Windaroo Park State School. They had 36 children who were close contacts from that cluster. 34 are negative, which is great. We have over 900 families self-isolating. Once again, those families are keeping Queenslanders safe, so thank you for what you're doing with that home isolation. And we'll go through that in a little bit more detail. The Health Minister will also update that last week Queensland Health administered over 125,000 vaccines, so that's a new record, which is great. And of course, Wednesday, our Boondall Entertainment Centre comes online as a vaccination hub this week. So if you're on the north side of Brisbane, good opportunity now to start registering to be able to come through to that centre. So that's fantastic news. So with those few words, I might hand over to Dr Young. Thanks.
Thank you, Premier. So no new community-acquired cases in Queensland today, and I just want to thank all those people who live in that Beenleigh area and go to either the schools there or to the childcare centre for all the work they've done. And similarly, all the people who've come forward who attended the marketplace and the nail salon. So we've been getting a lot of assistance from the community. I'm just going to go through why I think, because of all that assistance, that I think the risk is decreasing, which is fantastic, but it's still not zero, so I still need all of that support, all of that engagement. So we now have tested all of the 20 close contacts in the same child at the childcare centre that 4-year-old child attends. 3 staff and 17 children, and they are all negative, which is really good. But they will now need to complete 14 days in home quarantine, because we know you can still test positive, as we saw recently with Indooroopilly, up to 13 days after. So unfortunately they'll have to remain in quarantine. I thank them for that. Then we had those staff and children who attended the the Mount Warren Park State School, on Wednesday for an excursion. All of those children and staff have tested negative, so there's no concern at all for the Mount Warren Park State School now, which is great. Then we have those children who attend after school hours care at the childcare centre who go to Windaroo State School. So there are 36 children who go from the school to after school care. 34 out of those 36 have tested negative, which is fantastic. We're just working with the last 2 children, 2 young girls who at this stage their family doesn't want them to be tested. So we're just working through with the family. Until we get those results, unfortunately, those 900 or so families will need to remain in quarantine. I thank them very much, and I do hope we're able to work with the family so those 2 children get tested. If they get tested and they test negative, they of course will have to stay in quarantine because they were at the childcare centre, but it means all those other families who go to the Windaroo State School will be able to be released from quarantine, but not yet. So please, can all of you, as you've done so brilliantly, remain in quarantine. If you need any assistance with any groceries or any help, then please ring and get assistance, because I need you to stay there until those last 2 test results come through. So that's very important. Now, Stylish Nails, the nail salon. Can I please thank that manager and the 4 staff who work there for their involvement and engagement with us. So all those 5 staff, the manager and the 4 staff, have now tested negative, which is excellent. Then through work with them, through CCTV footage and through one person who came forward themselves, another person came through on the check-in app, those 4 customers have tested negative, which is really, really good. But unfortunately, there are still 3 or more patrons, 3 or 4, that we can't yet identify. So we have them on CCTV footage, but we can't identify them through that process. We don't have a name. So we're working with police and with the Stylish Nails salon to try and identify those people. I'm less concerned now that I've got information, because the person who was in the chair next to the 4-year-old girl has tested negative. So we've identified that person, and the gentleman, our original case, sat in 1 chair away next to the entrance. So I think we've found the highest risk cases in that salon, but I really would like to find those other 3 or 4 customers that we've identified on CCTV footage. So please, anyone who attended the Stylish Nails salon last Monday, so this is a week ago now, last Monday morning, could you please come forward so that we can test you? You are still a concern, and it's really important that we get hold of you. Now, going forward, could I please plead that people use the QR code. This is now 7 days since these people attended, and it's really important that we get people fast, because we know that the Delta variant can spread within 30 hours, and we've seen it with this young child, for instance, and her mother. So a week later is too long. We need to get hold of people earlier. That's critical. Then in terms of vaccination, so today there are 341 GPs in Queensland who have Pfizer vaccine that they can use. They're each getting around 300 doses per week of Pfizer vaccine that they can use for their patients and anyone who books in with their surgery. So could people please come forward, because GPs are not using their full amount that they're being allocated by the Commonwealth. So I do want them, every single one of those 75,000 doses a week that go to GPs across the state, to be utilised. Over the next few weeks, the Commonwealth is increasing the number of GPs. There'll be an extra 642 GPs. And by mid-October, GPs across Queensland will have 340,000 doses of Pfizer. So could you all please, if you haven't already had 1 dose of Pfizer, book in to your GP or find out where there's a GP in your area, or a Commonwealth respiratory clinic, or an Aboriginal controlled health service. All of those have got Pfizer that they can utilise. As well, of course, Queensland Health, we're rolling out as much Pfizer as the Commonwealth gives us through our clinics. It's really important. We've got a window of opportunity, as the Premier has said, before the virus starts spreading in Queensland, to get every single person 16 years of age or older vaccinated. Thank you.
Thank you. So the message is very simple. Test, check in and vaccinate. That's what we want Queenslanders to continue to do. This latest outbreak reinforces the importance of that check-in. We don't want to be trying to find people days later whether they've been to a venue. Now, it's possible that these people who haven't come forward to Queensland Health yet have gone off and got themselves tested and already have results. But we still need you to contact Queensland Health and tell us that you are a close contact at the Stylish Nails site. So please come forward and let us know. If you know someone who went to that shopping centre on that day, check with them whether they've come forward and let us know that they were at that site. It's really important we find these last few people that were at the Stylish Nails. But of course, very good news so far that all of the tests that have come back from all the close contacts are negative. As Dr Young said, we have GPs who are now got AstraZeneca and Pfizer in Queensland, and we have community pharmacies delivering AstraZeneca across the state, as well as the state vaccination hubs with Pfizer as well. So there are many, many opportunities to get vaccinated. We have about 35,000 people on the registration list at the moment, but we are clearing people as quickly as they come in the system. So we need people to keep getting registered so that they can get a vaccination, and especially with Boondall coming online this week, we want more people in the system wanting to get vaccinated, and we want more GPs vaccinating more people with both AstraZeneca and Pfizer, and of course our pharmacies with the vaccines that they'll be getting coming forward as well. So please everyone, keep up the great work, social distancing, good hygiene, getting tested if you have any symptoms whatsoever anywhere in Queensland, checking in everywhere you go, and coming out and getting vaccinated.
Good morning. So just a quick update on our operations over the weekend. 3,666 vehicles across our borders, 93 refused entry. Only one person had a penalty infringement notice issued for false declaration. We saw some activity at our borders yesterday, and we handed out 100 masks just on the Gold Coast alone. Obviously some of the vision you would have seen around people enjoying Father's Day, but I'm happy to say that we took a compliance and communication approach, and most of our community did the right thing. Only one person was issued with a fine for not wearing a mask. Overall, 7 penalty infringement notices, mostly in relation to people not following directions of health officers in relation to the current outbreak. I just want to mention that the new system in relation to returning and relocating Queenslanders has come into play. So that went live at 8 p.m. last night. The new direction came in under the Chief Health Officer's authorities. That has been operationalised. We have our workforce stood up. We are processing the applications, and as of 7 o'clock this morning, we'd had 107 returning Queenslanders applications approved and 149 relocating persons to Queensland approved. Overall, there'll be about a 50-50 split of that. We'll try to balance that out with people come in into our state. So just to remind everyone, what they have to do is they have to apply online to get the exemption as either a returning Queenslander or a person that's relocating to Queensland. And then when they present to our border, they must come in via air. They have to have a border pass declaration as well still. They must have that as well. And they must be able to demonstrate evidence to the satisfaction of the officers as they come in that they can prove that they are a Queensland resident. We do have sufficient hotel quarantine availability, so no pressures there. Over 800 rooms available in both international and domestic quarantine at the moment. So we will balance that out as time goes forward. Thank you.
Happy to take a few quick questions.
How disappointed are you that Queensland is last in the vaccine race, and will there be a briefing on how to speed things
don't think that's necessarily true because we're working with the Commonwealth Government, and as I said, the Commonwealth Government's responsible for 70% of the vaccination in Queensland and we're responsible for 30%. But what I've said very clearly, and I'll say it again, and I said it yesterday, we have this window of opportunity, Queensland, to get vaccinated now. If we get more supply, we can get more vaccine out. As Dr Young said, we have already over 300 GPs administering. We've got extra vaccination hub rolling out this week at Boondall. So we need Queenslanders to come and get vaccinated because the virus will eventually show up in Queensland. So the more people we can get vaccinated now, the better prepared we will be.
Will the government do to combat this complacency?
I think Queenslanders do want to get vaccinated. So we want to really stress, and I know the Commonwealth has run a campaign as well, but we want to stress to Queenslanders, now is the time to roll up your sleeve and come and get vaccinated.
The GPs do have access fast but not using though. Has there been an issue around the messaging, do you think, in Queensland?
Well, I think there's up to the GPs, that's done through the Commonwealth level, that they need to make sure that everyone knows where they are and they're getting vaccinated, and my understanding is that families are going in and utilising that. But also too, we've got a big network of community pharmacies as well. So there are a lot of options for people to get vaccinated, and of course there's the hubs. And what we saw yesterday, over 800 people down in Logan turned up, walked in and got vaccinated.
Is the government any closer to looking at drive-through options? The opposition's been calling for that for a while.
We don't need that because we don't have virus ripping through our community at the moment, okay? So if you had that situation, you would have to look at all options. At the moment, we are free to move around and to go and get vaccinated. So Queenslanders, please go and get vaccinated.
Given we don't have an outbreak though, wouldn't it make sense to look at all of our options now before that?
We don't need that. If we need to stand that up, we can stand that up. But people can go in and go to their local GPs, they can go to their pharmacies, and they can go to these hubs that we have. We've got vaccine hubs now at Logan, Rockley Showgrounds, Ipswich, Logan TAFE, Caboolture. We've also opening up a community vaccination centre at Mount Warren Park on the September of 11. So you're going to see more and more vaccination hubs roll out across the state.
Is that not needed though because of the low numbers of people sitting on the register at the moment?
No, it's because we haven't had the supply. So now the supply is coming in. The federal government has secured the extra supply, so we are able to get more jabs into people's arms.
That's Pfizer though, there's plenty of AstraZeneca floating around.
People can go and get their AstraZeneca as well. There are a lot of options open to Queenslanders, and now is the time to get vaccinated.
Health professionals say that there's still a lot of hesitancy around AstraZeneca. How much responsibility has the government take for that messaging?
There is a whole range of vaccines available. Moderna's coming as well, and everyone, if they can go and talk to their GP to see what is suitable to them.
Dan Andrews said last week.
Sorry?
So Dan Andrews said last week that unvaccinated people in Victoria won't be able to enjoy some of the freedoms that vaccinated people have, like going to the pub or the movies or whatever. Well, unvaccinated people in
We're
Queensland-
not in that situation, Lydia. Like in Queensland now, our cafes, our bars, our restaurants, our shops, our retail, our businesses, our mining communities are open. We are open. Now is the opportunity to go and get vaccinated.
Once we hit 70 to 80% and the country opens up though, will those people who haven't come forward to get vaccinated still be allowed to go to the pub?
Well, what we've said very clearly is that everybody should be offered, eligible Australians and Queenslanders should be offered the opportunity to get a vaccine. Now, in relation to the second part of your question, they're matters for National Cabinet.
That you don't have an opinion on that?
No, they are discussions that need to happen at National Cabinet.
Given
The state
some
government
sections
has
of this,
mandated the vaccine.
Sorry?
The state government has mandated the vaccine for police. Why can't we do it for teachers?
We're encouraging teachers to go and get vaccinated. We know that teachers are also part of the front line of our defence against this virus, so we are encouraging people to go and get vaccinated. Police have put that, I might get the Deputy Commissioner to talk more about that. The Commissioner has put that directive out for police. Police are on the front line as well. So that's for police, and we're encouraging teachers, of course. They can go to the front of the queue and get vaccinated.
Given your concern with kids though in COVID, why can't the government mandate it?
Well, a lot of teachers already had their vaccine and are getting their vaccine. So if there is an issue, we'll look at that.
Premier, what's the hotel quarantine cap here in
I think the Commissioner said, was it about, Deputy Commissioner?
Yeah, 800 spare rooms you
Four?
mentioned, but is there an actual number for the cap?
So the cap is, the international cap is currently 650, so
Correct.
half the normal cap.
So yeah,
we have
international.
in total.
And we were taking double. So what the Prime Minister wrote to me about Tim, he wrote to me and he said that should ease in September and October, which is now what we're seeing, which means we're able to have more hotels available for returning Queenslanders and people wanting to relocate to
Is
Queensland.
there actual cap number though for like total number of rooms available?
There was a cap for international, yeah. There's a cap from the federal government that different states and territories have at the moment for the numbers of returning international
No, I'm
visitors.
talking about like just a total number of hotel rooms available.
My understanding was about 4,000.
3,800 over.
3,800.
And the NRL regular season finished yesterday. What happens to all those teams and families who aren't playing in the finals?
Oh, look, I don't know that. I'll have to find out.
Premier, were you disappointed that people were gathering on the borders, pulling their masks down, kissing, hugging?
Look, I addressed that yesterday. In Queensland, people are free to move around, and you know we don't want to see the virus come into Queensland. And at the moment, there are stay-at-home orders for people in New South Wales. So that's an issue for New South Wales if New South Wales people are actually moving around.
It is a risk though for Queenslanders when Queensland people are going down to the border, pulling their masks down, hugging these people who are in New South Wales and then coming back after mingling with other people.
Yeah, well, my understanding is that police, and you heard the Deputy Commissioner talk about that before. You know, they saw what was happening down there. There was, you know, they monitored the situation, and look, we want to make sure that people are doing the right thing, and if people don't, they are putting their families and others at risk.
Premier, given the...
Sorry, last one, and then we'll go to Dr. Young, and we've got Cabinet.
Given some sections of the state, particularly with Sundays and maybe diverse areas, only about half the full vaccination rate of some of the areas around Brisbane, are there any plans to wait until those individual areas reach the targets before moving to the 78?
Well, I can tell you now, I look at those figures every week, and we are going through and prioritising where our communities aren't up to the 50%, and we are trying to make sure that we are giving a very clear message, but also to, like I said to you, the federal government is responsible for 70% of the vaccine, we're responsible for 30%, but I want to see all of Queensland move at the same level. So we are looking at those pockets where there have been not the same levels. In our densely populated area of the southeast, we had concerns about Logan, Caboolture, the north side of Brisbane and Ipswich. We've addressed those issues by making sure that we are establishing vaccination hubs in those areas, and we are making it easy for some communities to do walk-ins. Some people, for a whole range of reasons, they may not have computers, they may not be able to log online to the Queensland Health website. We are making it easier for people to go and get vaccinated any way that they can.
Places like Sherbrooke have a vaccination rate of 4%. What's being done to try and reach that to reach?
Yeah, and I know in other parts of the state too, there have been low levels of some of our First Nations people going and getting vaccinated, and we are looking at their community centres to make sure that we can actually get more supply into those areas and encourage those communities to get vaccinated. And we're also doing targeted up in the north of the Cape areas. We've done the Torres Strait. This is a big state, 2.5 times the size of Texas. There's a lot of communities. We've got small planes flying out to remote and regional parts of our state to get people vaccinated. Where we see there's issues along the borders, remember we had a vaccination program there. But can I just stress again to Queenslanders, now is the time to get vaccinated. Not when the virus gets here, now is the time. There is a sense of urgency here. There is a sense of urgency for people to get vaccinated. I said it yesterday. Dr. Young talks about it all of the time. This is our window of opportunity, and we should make sure that we utilise this window to get vaccinated. The federal government has said more supplies are coming in the next few weeks, so we will see more people having the ability to get vaccinated, and as more GPs come online, more people will be able to get vaccinated going to their local GPs as well.
Dr. Young,
Last month's thanks.
so the Premier has been saying that the chance of Delta coming to Queensland is going to happen sooner rather than later. Has your advice for young people receiving AstraZeneca changed as a result of the risk profile of Delta?
We do not have an outbreak in Queensland at the moment. We don't have community spread, and I hope it remains that way. Our biggest risk in Queensland today is actually the freight drivers, because they're one of the few groups that can still freely move out of hotspots and across the border into Queensland. And we've seen over the weekend we had 2 new freight drivers, plus we had the freight driver down in Bingley. So they're the big risk, which is why we need to keep wearing masks. That's absolutely vitally important. Get vaccinated as soon as we possibly can. So we should all, if we haven't already got vaccinated, go and find a way of doing it. If you're 60 years of age or older, go and get AstraZeneca from your GP, one of the Commonwealth vaccine clinics or one of the pharmacies. There's many places. If you're 16 through to 59, go and get Pfizer from one of the GPs, and there are more GPs coming online every single week, and they have spare vaccine because people don't know they've got it. So go and find in your area a GP that has Pfizer and book in, because they're about to get very large amounts of the vaccine. So you mightn't be able to get vaccinated this week, but in the next few weeks you definitely will. Plus we're standing up more and more hubs across the state, and we're going to start opening more and more of them to walk-ins. Once we've used up all the bookings and we're starting to see that, we'll open them up so people can just walk in. That's critical, and we've all got to do this as quickly as we can. Then, when it's time for your second dose, 21 days after your first dose of Pfizer, you need a second dose. At the moment, it's 12 weeks after your first dose of AstraZeneca. You need a second dose. That will give you the best protection. Now, I'm sorry to be confusing about it. If we were to have a sustained community outbreak, that would reduce the time before your second dose of AstraZeneca. But at the moment, it's 12 weeks.
Thank you.
Thank you.
Gotta go.